see so much messaging on social media about what we all should do to avoid getting and spreading COVID. But the science and the messaging keeps changing because the virus itself keeps changing. So I decided to spend a day with Dr. Frank James, Health Officer for San Juan County, and see what's going on from his perspective.
There's no law against jaywalking here. I love little towns. And there's not a stoplight in the whole county. This Vic's our only fast food restaurant, and wonderful people with wonderful place. And they do a great job, but it's really difficult. They've really been strained by the challenges of telling people they got to wear a mask or they got to do what they have to do to keep everybody safe. Wonderful people. Shall we step inside? Can I bring in somebody with a camera?
Yeah. Hi, Frank.
Awesome.
Hi,
how are you guys? It's good to see you.
Good. Nice to see you too.
How you been?
We've been well. Been good.
Yeah.
Yeah, just doing our thing.
Business good?
Yeah, it's been pretty good. We were closed for like a month and a half.
Yeah.
And then we reopened January 2nd, so.
Are people behaving themselves?
More so. It took about 3 hours after our first day to have another incident.
Yeah.
But that's just where people are at right now.
Yeah. This is our county courthouse. We occasionally have about a dozen protesters out there objecting to the masking order that I wrote. Early on at the very beginning, I wrote a masking order that basically said you had to wear a mask inside of any business. The unique part of it was we punished the owner of the business. The owner of the business got a $1,000 fine and 90 days in jail if they let people in without a mask.
So that's basically working?
It works superbly well. Everybody complies. If you walk around town, you'll see everybody's wearing a mask inside. They really respect the business people, and that's a good thing. It's putting a big burden on them, and I know it. Every time I want to make a change, I actually talk to the business community first to make sure that they think that it's something that'll work and that they can do, or I don't do it. We actually had an outbreak at the American Legion, and it's really interesting because the same people go there as go to one of the other clubs in town, and the outbreak was related to having meals together. And older folks, they all did well, fortunately, because it was pretty difficult outbreak to investigate. But we did it, and they all got on board and got it stopped. 35% of our people are over 65, which is more than double what it is in most counties. So it's a big retirement community and a fairly affluent community. But there's also a substantial service sector of people that work here and live here that aren't rich or aren't well off. They're very much working class folks. And of course, there's old islanders that have been here forever, and then there's new folks. This is downtown. Yeah, this is where all all the food comes aboard, all the tourists come aboard right there. The ferry line. The ferries have been a little problematic. They were a little inconsistent in enforcing any masking, and they still don't really enforce it. They just recommend it. Even getting them to put a sign up at the ferry that say that we have a requirement here in this county. I had to get the county health officer from Skagit County to issue that order because they wouldn't take my order to put up a sign that said masking was required. It was a difficult discussion with them. It's a beautiful place here. One of the attractions is actually how pretty it is and how interesting the people are. In the summer, it's overrun with people. That's the biggest challenge, I think, for the COVID response, in fact, was really what to do in the summer.
Does anything come to mind where you have had unreasonable resistance?
Oh, I've had a death threat, yeah. I mean, there are people that are convinced masks will kill you. They really believe that. There are people that think vaccines are putting toxic things into your body or microchips or stuff. There's people sincerely believe that. So there's definitely people that don't like what's going on. But I think overall, more than any county I've been in, the tenor and tone is one of support and unity about fighting this, as if you were in a war almost. We have an enemy, and we all got to pull together to make this work. So I think that part of it has been extremely gratifying, and also something that is what's allowed it to work, is everybody's on the same team, overwhelmingly. Hey, thank you. How are you today?
I'm well. How about you?
Good.
You don't usually...
Hey, Mark.
Hey, Dr. James.
So I was wondering how we're doing on the immunization race these days. Where are we at?
We're actually doing very well. We're at, I could actually tell you, we're over 86% have initiated total population, and fully vaccinated, we're almost at 80%. That's total population. If you break it down to...
Does that include birth to 5?
That's birth to 5.
Well, that's pretty high.
Yeah, so if you look at 16 and older, we're at almost 92% of our population has initiated immunizations, and almost 85% have fully vaccinated. If you look at booster doses, we're over 8,000 of our residents have received a booster dose, which is 63% of our fully vaccinated 16 and older population has received a booster dose.
This is Emily Mason. She's a nurse that I work with, and she does the contact tracing and case investigation. These are the people that talk to the really difficult folks. Sometimes they call people that don't want to be called. Sometimes they call people that are not appreciative of the help. But for the most part, people are pretty good, and the team is highly skilled and highly trained in that interfacing about diseases. When she's not doing this, she does sexually transmitted disease investigations, which makes this look easy.
And how stretched have you been?
We are definitely at a past a surge capacity right now, which just means that the volume of cases are greater than our staff's ability to keep up. And so what we do is we try to categorize different cases based on certain factors: age, exposure to the community, other medical risk factors that we may become aware of, and we prioritize them first. So we investigate our high-risk folks before anybody else.
So kids, people over 70, people with immune-compromising conditions get prioritized, and some of the other people won't get called.
Yeah.
We've been moving for several weeks now in a direction where we try to educate people and make things available to them so that they can access the information and take the right actions for isolation and quarantine on their own. Hey, Zoe.
Hi.
So this is Zoe, and Zoe was a food inspector and inspected restaurants. And then when COVID came, she got pulled into the contact tracing case investigation world. And it's worked so well that she's going to keep doing that when she's done with this, and do community health stuff instead.
Yeah.
So it's how's that worked out?
It's been great. I've learned a lot, and I've got to meet a lot of people in the community, and been working hard to keep everyone safe.
Yeah.
Yeah.
And that's pretty rewarding.
Yeah, it's very rewarding.
So Ellen Wilcox was the main organizer of our strategic effort to control COVID in our county over the past 2 years. And she's a social worker by training, and an amazing organizer of people and stuff.
But I think one of the challenges in public health, and certainly that's been very prevalent during this response, is we're trained to be thinking way down the road, and ideally that's with a prevention lens. And yet we've been very reactive and responsive in this pandemic response. But it can be a very lonely place also, to be privy to information or just even a way of thinking that is so far down the road. And the rest of the community, and sometimes our families and staff, aren't quite ready to be thinking that far down the road. And that can be a lonely place in public health at times. And I also have been really struck by how quickly everyone does catch up to that place. And I think that's just been the nature of this response over the last 2 years.
we had a lot of people coming here from all over the world. I mean, we've got a very vulnerable population with 35% of our folks over 65. We have people coming here from New York, from Paris, from places from Asia that were the epicenters of this infection. So we wanted to shut that off, and what we did was we put in orders that made it, really closed a lot of the places that people could stay. That was very difficult, and the hard thing from a public health point of view is we were choosing between lives and livelihoods, literally, and there were companies and there were people that were on the edge of bankruptcy because of the prohibitions we put in, not for masking, but actually for being open and having the ability to put people up. So we closed parks, we closed and campgrounds, we closed businesses where people could stay, VRBOs and the Airbnbs and the hotels and that was really hard because there's definitely a tension there, and there were people in really hard times. But it's the only way to limit the number of people, the flood of the tide, and the more successful we were, the more people wanted to come here. There's a huge influx of people that moved here to live here because it was such a safe place, and many people had second homes or third homes in some cases that chose to come here and live because it was so safe. So I guess the question is, what have we learned? And the key lessons for our community and for myself has been that caring is what really works. People wear these masks, even though they're a bother, because they protect other people. Even now, we have young people under 5. Half the hospitalized folks are in that group for pediatrics. The people over 65, the immune compromised, and even the unvaccinated. We got to protect all those people, or they can die. 850,000 people have died. We haven't lost a single member of our community. And if we had, it would have been someone's mother, someone's father, someone's child, someone's grandparent. It's something we got to protect, and we've got to continue as best we can. And I think that caring is the engine that makes the whole thing work.